I wanted to jump off of what you were saying about the government's willingness to increase the Canada Health Transfer, and if I'm hearing you correctly, also explore more tailored bilateral agreements with the provinces. I spoke to Adrian Dix last night, who said that he's still not clear exactly what the government is looking for in order to get those negotiations moving forward. So I'm hoping that you can kind of pull the curtain back a little bit, explain to us exactly how these negotiations work and what conditions you've put to the province and kind of a timeline for getting those talks moving.
Thank you, and I will gladly do so, taking the curtains back, as you say. And that brings me back to the last year, during which we had 12 meetings at the health minister's level, obviously many more meetings between officials and many others. And during those 12 meetings, with the leadership of Minister Dix in particular, and the leadership of other provincial health ministers, we made very serious and good progress on two big pieces. The first one was how to support healthcare workers, to retain them better, to recruit them, to recognize their credentials, to train them, and then on data. And because data saves lives, how we can have in Canada a modern health data system that provides data to healthcare providers, to nurses, doctors, specialist physicians, pharmacists, so that the data on people's health are available when these people end up in an emergency department, or they visit their physician, or they go to visit a pharmacist. So how do we make sure that that data supports their health and the work of workers? We were going to the Vancouver conference with great hopes that not only would we finally agree on all of that great work that Minister Dix and others had done, but also we would share that work publicly. Unfortunately, just a few days earlier, my health ministers received an order by their premiers not to speak about those results publicly. And that's the unfortunate, that's an unfortunate thing, because before we come to the means that we need to achieve some ends, we need to agree on the ends and to speak publicly about them and the results that come from investing in workers and supporting patients. So where we are now is we're continuing our conversation. I've met all my health ministers. I've been speaking to them almost weekly in various ways, and we know we'll get to an agreement on outcomes at some point. But we need more work. And we need premiers to let us do that work.
Based on my conversation with Minister Dix, he was under the impression that he doesn't know what the federal government wants, and they might be willing to give it if they knew what the federal government was looking for. Is the ball in their court to come to you, or is it up to you to tell them exactly what criteria you're looking for?
The ball is in the premier's court. At the health minister's level, we all agree. We've got a great relationship. We agree on the diagnostic. We agree on the problems and the solutions to those problems. We were in total agreement in Vancouver in private. The problem is that the premiers don't want us to speak about those outcomes and those results. They want to maintain a futile fight on dollars. And that's a futile fight because they ask for 35%. If you do the calculations correctly, we're already at 35%. If you do what premiers ask us to do, if you add the whole package, the cash transfers and the transfers that come with the tax points, we are at 35, roughly speaking. We were a bit above 35 during COVID-19, which we're roughly at 35 now, and we've been at 35% for the last 50 years almost. Now, in addition to CHT, the tax points, as we all know, we have been investing and we keep investing in the fight against COVID-19, $72 billion in total, plus all of the additional transfers for home care, mental health care, and long-term care, not even mentioning the $2 billion additional that we sent a few weeks ago to reduce backlogs in surgeries and diagnostics. So on the dollars, it's not a useful fight. If we were to only focus on 35%, we wouldn't do anything more. But the Prime Minister did commit that we would be investing even more in terms of resources. But we need to agree publicly and to speak publicly on the results based on the hard work that Minister Dix and many others did in the last year.